we have a look at this component. It's called the pillow speaker, where the patients can use to communicate with you with the nurse station. So you have here the important function you need to understand is that this is for the normal call. So if the patients need to call you, he or she can press on this button and then use this pillow speaker to communicate. Okay? And then we also have some specific calls, which is the bath request or the toilet request, and then you have the pain medication request. So these will help you to have like the specific calls identified at the nurse station. Okay? And then this is, again, this is the way the patients could communicate with you, which could include the microphone. However, the patients can also send a call using the bell. So you can see here some nurse station, or sorry, a nurse picture that indicate that this is the nurse call button. So they can call you using this button, but they will speak from the pillow speaker. Okay? So another thing that you have is called the staff console or the staff station. You have it here. So you can come closer so you can take a look at the staff station. So the staff station, it's a station for you to use to send specific calls. You could use it also for some functions to enhance the workflow, and we'll take a look at each one of these functions. So if we go inside the room, but
so basically, if now I call from the other room, it will ring here.
Yes.
And if the patient, suppose he's curious and want to answer
No.
the call of his neighbor.
No, he shouldn't answer it. This is,
He shouldn't, but he would be.
Yeah, but this station is for the staff. It's not for the patient. So usually, if no one is attended, it's better to keep it away from the patients.
But it will cause a noise. It will be showing that there is a call.
No, actually, it will be like there is like once it's not being in use, there is like a sleep mode which only indicates like headroom.
And there is a voice call.
No,
It
the
won't show.
voice is from outside.
Ah, okay.
So here, if you go inside the room and you're busy-minded with your other patient, then you go, I think, and
Yes.
enable the screen and see.
مش إذا دق بغيرولة بالموضوع هيك قصدي.
Yeah, this is not the
Good
best
point, though.
practice.
Good point, yeah.
But I'm just here to show you the different calls. Again, this window is available on the nurse's station where you should answer all the calls. But in some cases, sometimes you need to check the calls from here. This is to help you to enhance the workflow and reduce like the amount of work you need to do. So instead of going out, you could check your patient's need from here. Okay? So this is the call menu. Again, you could answer the call from here, but it's better to answer it from the nurse station, depending on the situation. Okay. You also have the rooms window. So for rooms window, you could you could call different rooms, include calls. You could use it also for some functions to enhance the workflow, and we'll take a look at each one of these functions. So if we go to the menu, you see the main menu. You have different icons or different functions. So first you have the calls. So in the calls, if there is any calls in the departments, it will be shown here. And the reason why, for example, and this is again, this window is available at the nurse station, but the reason we add it here is, for example, one nurse can manage 2 patients or 2 rooms. So if you are inside one of the room and then you heard some call outside, you can check from here if it's your patient or not. You don't need to go out of the nurse's station and check. You can see it from here. And you could answer the call from here, but it's better to answer the call at the nurse station for the patient privacy because there is no handset here. Okay? So this is the calls, and I just want to show you like the different calls. For example, you can see this is like, for example, a normal call from ICU 5, and then the wait time until response, and then if it's the status of the call. If you have like a specific call, like for example, path request or a pain med request, you will have it identified as a call type, which will help you a lot in identifying the different type of calls.
This will be inside the room, the station.
Yeah, this is inside the room, but
So basically, if now I call from the other room, it will ring here.
yes.
And if the patient.
Outside, if you look at the dumb light up, so this indicator, you will have, there's a specific color that's mean different things, you will have it. So this means that the patient's doing a procedure inside. So anyone from outside can check and identify that the patient is going through a procedure. So if you want to deactivate it, just press again on the same button and it will be deactivated.
And if we press the doctor's presence, also there will be indication.
Yeah, so there will be a call and then
good.
an
Different color.
And if you have two, it will prioritize. Okay? Like for example, okay? So it
There's
will
nothing
take,
important than food.
it depends on the configuration. So it depends on the configuration, it should be again like that. Okay, so this is the request. You have the food tray, you have the cleaning, you have the doctor in room, you have transport, the procedure, and MPO. Okay, all of them will send call to the nurse station. Okay, so this is the request. You also have something important, which is the reminders. So at the reminders, you have a reminder for the rounding. So rounding should happen every 1 hour, right, for the patients. So sometimes you have like the ratio is low, like for example, the ratio is high, one nurse can manage like 4 to 5. It's not applicable in ICU, I know, but sometimes you need some reminders for the rounding. So you have it here. I activated once I came. So what else you have? For enhancing workflow, we also added the requests. Okay? So if the patient requests anything and you are inside the room, or let's say not a request, it's sometimes needs that you need to send it like for other person, or you want to send it to the nurse station, but you don't want to go out the room and then talk to another one. So you have here a specific request, like for example, the food tray inside the room, and you want the cleaner or the aide to come inside and take it. You could activate this request. Or for example, if the doctor in room and you want to show some indicator that the doctor inside the room, you will have it here. If the patients need to be transported to doing any X-ray procedure or anywhere, you could activate it. So what will happen if I have the request? We have the request here? Like for example, if the patients there is a procedure going on inside the patient room, and I press the procedures, what will happen? So the system will send the call to the nurse station, so the nurse in charge or the head nurse will be notified at the nurse station, and again, there will be some indicators. You can see the window that will appear at the nurse station that there is a call, and the status of the call. You will also have some indicator outside. If you look at the dumb light up, so this indicator, you will have, there's a specific color that means different things. You will have it. So this means that the patient's doing a procedure inside. So anyone from outside can check and identify, but sometimes you need some reminders for the rounding. So you have it here. I activated once I came. So what will happen? So now you can see there is a count that will count the time until the hour is finished, and then it will give me a reminder, which will send a call to the nurse station, and it will show at the dumb light. So it will give you a lot of indicators that mean I need to come inside the patient's room. Okay? So this is the rounding. So now it's activated. You can, for example, if you want to put it on hold or you want to close it, you could press on complete all or hold all, because you only have one reminder. If you don't want to do that, like for example, you don't want to deactivate some reminder, you want it to be on all the time, in case you forget to activate it again, but you want to take the patients outside the room for some procedures. So what should you do? You go for this button, out of room, you put the patient is out, and then the reminder will be on hold automatically. Once you bring the patients in, you put it in, if you look at the reminder, still activated. Okay? But since it's put on hold, it's counting 1 hour again, because it's assumed that the patient just arrived to the room. Okay? So you also have, there is some buttons, like manage the bed. Again, it's not activated. This requires a bed connectivity to send some information about the bed. Again, this station is for you as a staff. You could use it for enhancing your workflow, sending. Again, there is also another type of call, which is the emergency. Like for example, not life-threatening, but a patient has fallen or anything. The patients need an urgent help, and you are inside, but you want someone to come to help you. You could send emergency call. Again, the emergency call, since it's an urgent, it will show like a red color and cannot be cancelled from outside. You have to cancel it from inside by pressing cancel. You could also have the assist call if you need someone to assist you in changing for the patient's repositioning or anything, something that's urgent. You could send a call, but this call can be cancelled from here or from outside because it's not urgent call. Okay. So you also have here, if you want to clean the device, which is very important, so to prevent from damage, since it's a touch screen, so cleaning is wiping, but just you don't want to mess with all the functions, you go to the system info and then clean the device. It will stay for 15 seconds where you could wipe it.
Okay.
Please don't spray anything on the screen, just on the towel or something, and then wipe it. Okay?
Why there are numbers inside that? Can
So,
you use as a remote for?
Yeah, but it's
for-
not integrated. It's not requested. But if it can be integrated
Numbers,
to control the TV.
For what?
For the TV.
Ah,
But there's no TV, so no need for that. Okay?
Even for the TV, they're upstairs.
Yeah, it's not requested. So if they requested, or I think it's like they will check the
Yeah.
integration. You as a staff, you could use it for enhancing your workflow, sending reminder, request, calling. But you could also send a specific call from this station. Like for example, code blue calls can be sent from here. So you just pull the lever down and it will send a call. You could see the lights will be flashing blue. All the like the section of the light will be blue to indicate the importance of the call. So if you want to cancel the call,
هيرد الانترنت؟
yeah, he answered.
alarm صح؟ كل coding في system unit internal alarm بس when you pull the lever.
Yeah. So this is the code blue. Yeah, we're just testing that. Sorry. Okay. So the code blue is just you have to pull the lever down. If you want to cancel this type of call, you have to enter the room because it's an urgent call. It has to be cancelled inside the patient room. So what you will go, you pull the lever up and then cancel the call. It has to be from inside. You cannot cancel it at the nurse station.
Sure.
Again, there is also another type of call, which is the emergency. Like for example, not life-threatening, but patient has fallen or anything. The patients need an urgent help, and you are inside, but you want someone to come to help you. You could send emergency call. Again, the emergency call, since it's an urgent, it will show like a red color and cannot be cancelled.